All right, hey guys, so we're back to the forward head position kinetic chain and how it affects your entire body. We've already gone over the jaw, the back of the head, the neck, the trap, and the shoulder. Now we're gonna go over to how it affects the hips and the low back, the hip flexors and the low back. So a very easy way to test if you have hip problem or low back problem, first of all, is if you have pain. Clearly that's a problem. Secondly is, are you going to have these problems in the future? So the easy way to tell if you have a problem with this or going to have a problem with this is, are you able to lift your knee higher than your waist? Okay, so what I'm going to do is I'm going to pick up my knee, both legs. Can I pick up my knee higher than my waist? Now, of course, that's pretty high, but if I can get about waist high, that's still very good. But if your head is very forward, if you have your hips backward, because that tends to happen when your head is forward, as if I do this, my head's forward and my hips are back, now I'm going to try to pick up my knees again, and it becomes extremely difficult. So what I've seen in the past is, when I would go to any fitness class, is people would have people march in place. It's a very simple concept of exercise. It's better than jogging in place. The problem though is that the positioning of these individuals with the head posture forward, the back going backward, is they're just doing the movement but not doing it to its potential of what would actually fully benefit them. So, and here are a few things that we're going to go over, a few things that actually help us get out of this position and into a place where we're not going to have this hip problems anymore or this low back problems anymore. Before we get into the lower portion of the corrections for the hips and low back, I really want you to refer to the first video of how to get the head backward, the exercises and stretches that I want you to do in order to reposition your head backward, because if not, then we're going to be missing a huge piece of how the head and the hips correlate with each other. Okay, so the first thing we're going to do is a very simple wall hip flexor stretch. Okay, first thing we want to do is be aware of how our feet in the back are positioned. So I have this high heel in the back. Reason being is because whenever we walk, we go off our toes. So whenever we step forward, the trajectory of our body is moving forward. So I want my leg to be pushing my hip forward. My leg must feel like it's moving forward, so my heel should go high. It's kind of an exaggerated heel position, but it does help the leg push forward in the joint. This is not common for a lot of people. So be very aware of the sensation of any back compression. Most people will have their backs positioned backward and not feel anything in the front. So what I invite people to do is to really try to tuck their hips underneath them or crunch their stomach so that they can position their body in a place where they feel the stretch in the front. Now that I feel the stretch in the front, my front leg can go as far as I want it to be for stability, of course, but also just enough to where I feel a significant amount of stretch, but not to the point of pain. Then I'm going to lean against the wall and rotate my torso. I'm keeping my stomach underneath me, and when I rotate my torso, it turns my hip forward, which makes the stretch even deeper. You can keep this for 5 seconds at a time, maybe even 2 sets of 5 seconds. And then when I rotate the other direction, my other leg is already in that position because I've already positioned myself against the wall. And again, do the same thing, bring my heel high, hips underneath me, crunch my ribs. I don't want to feel anything in my low back, only a stretch on the leg that's against the wall, and then rotate again toward the opposite side of the wall. Again, 5 seconds, and then you can repeat that. I usually recommend people doing this every hour on the hour, especially if you're sitting down a lot, because it's very common for the tissue to get too short and over time creates a bad hip position, which makes the head go forward. And then we're looking at all these other problems that are developing. So continuing on from the hip flexor stretching, we can't forget the lower portion of the quad. So the hip flexors actually are the upper portion of the quads. So the quads pick up the leg and also extend the knee. The lower portion of the quad extends the knee. So this is the portion that we want to make sure that it's flexible as well, because it can take away from function of the supporting muscles like your glutes, which help protect your back. Okay, so what I like to teach people is a very simple quad stretch. Typically, people like to stretch with their back standing or their body standing up. My problem with this is that the hips are too posteriorly tilted, which most people are trying to get rid of that. So in order to get rid of that, I have them use 2 chairs, and the front leg is going to be closer to the front chair to balance. And then I'm going to start dropping my knee down. When I have my knee bent this way, my hips are underneath me automatically, and my knee is now being stretched, or my quad is being stretched, and getting my heel close to my glute as much as possible. And then the more flexible you are, I recommend bringing your knee further back behind you. This can become extremely sensitive, so I very much recommend holding on to something. Take your time with this. It's not exactly a easy thing to get in and out of. I understand that, but the more you do it, the better it becomes, the easier it becomes, and it's a very good addition to making sure that you also have even knee health, because the quads obviously take over, make the knee function, make the knee extend. So now that we've gone over the hips, the front of the hip, the bottom of the quad, we will now go over another stretch for the low back. So now that we've gotten the front, we now are going to stretch the back side. The low back is very thin, and the only real muscles that you want to stretch in the low back are actually called the quadratus lumborum, the QLs. And what their function is to bring your hips backward and also tilt one way or the other. So if your back is stuck backward, you're for sure using those QLs. And if you're walking with a little bit of a waddle, which a lot of people do in that position, you're going to be making those muscles extremely strong. And when those muscles are extremely strong, they take away from the muscles that are in the front, which can create also low back and hip problems, or hip problems without low back problems. So the symptom doesn't really matter, but this stretch is very important to do if we're trying to resolve either one of those issues, okay? So the first thing you want to do is push your stomach down and underneath you so that you can create a little bit of a round of your back. Now that I have the round of my back, I'm going to choose my left arm to come up. So I'm going to reach toward the wall. But I'm not reaching over this way. I'm reaching in line with my arc, so that my arc is creating much more of a round. Then I'm going to take my other hand and try to push to the opposite side. Now that I feel some stretch on the side there, I'm going to push my hip even farther to that side, because the arm is going this way and my hip is going that way. So there, it's stretching. We're getting 2 ends, 2 points that are going opposite directions, which creates the stretch. I'll do it on the other side. Again, I'm going to bring my stomach down, push my hips backward, bring my right arm over, then look over to the wall. Here, now that I have that position, I feel the stretch. I'm going to make it even bigger by pushing my hips even more in that direction. And then I'm going to come back. We can do that, I recommend 2 times each side. It's very quick release and it's very easy to do anywhere. Okay, so this is not a stretch and it's not an exercise. It's actually called a traction. And we need tools to do this traction. And we're going to be tractioning the femur bone in the capsule of the joint, the iliofemoral joint, meaning that where the femur meets the ilium, the hip bone. when this joint can be traction forward, it can take a lot of pressure off the low back and also help the front stretch, which can allow muscles to actually be utilized and worked. So what I have here is a very thick elastic band, and we call a door anchor. This one's already attached, but this is a door anchor here. Sometimes these are sold separately, sometimes these are sold together, but I want you to see what a door anchor looks like. So, and they're called resistant band door anchors. Get them on Amazon. They have various styles. Okay. So what you would do is you would loop the band in between the door anchor and then make it tight, nice and taut and tight, and move it and put it between a door. Now, of course, if you have a post to wrap the band around, you wouldn't need one of these, but because there's doors around, a lot of people don't want to do this stuff outside. And you want to make sure that you're doing this where the door closes in the direction. So I don't want to put it in where the door is on the other side, because the possibility of the door opening when you're pulling this is very high. So close that up, and I double check that that's not going to come out because it's right behind the door wedge. So this is pretty safe. Now I also want to put this above the door knob because I don't want it to slide down. I want the angle to be about a 45-degree angle. And what's going to happen also too is I want the height of my knee to be about a fist high. So I have these yoga blocks here and a little pillow on top just to make it a little softer on my knee. And I'm going to be placing my knee on that. But before I do that, I put the band right behind my leg. And I put it just underneath the glute where the hamstring is attached to the glute. I'm not going to put a lot of tension on this, but I would typically want a high amount of tension. So I'm going to bring my knee down forward onto this pad there. And some traction, you want to feel enough, but the further back you go, you're going to feel more traction. If I was to bring this pad back more, of course, it's going to be pulling me forward more. So it's important that I have a good base on the front leg. I don't want the leg here because it's going to be easy for the band to pull me forward. So I want my leg to be not at a 90-degree, but more of a 45-degree, or more so like a 120, 110 degree angle. And I'm going to be pushing with that front leg. My hips have to tuck underneath me. Okay, so I recommend we traction after you've done the hip flexor and the quad stretching so that you're more likely to position yourself in a better position for this maintenance of the hold, or holding this better. Now that I feel the band pulling me, I'm also going to rotate just like the front hip flexor stretch, just enough to rotate my hips forward. That adds to the stretch in the front. I don't want to feel like my low back is getting any tension. That's not the goal. And I would stay here for about maybe 2 minutes after my body's already warm. Anything less than that is when your body's cold. So maybe 30 seconds to 1 minute is if you're not very warm. You do this on both legs, and I would recommend you do it twice. 2 minutes, 2 minutes, and then another 2 minutes, 2 minutes. After that, you would feel a lot of tension or ability to access your glute muscle, which is going to help that relief of your low back and support your legs to stay underneath you so that your body can continue to heal itself. So now that we're all stretched out and we've already done the traction, the last thing I like to do is to activate the glute muscle. The glute muscle is the big dome, the glute max. And we can also incorporate some glute medius and some glute minimus into this, the other glute muscles, just that help support the low back. Now, how I like to do this is to have the leg in extension, meaning that my leg is going to be behind me, okay? This is leg flexion, this is leg extension. And now that I have a leg extension, I want to be positioning myself just like if I'm doing the stretch for the hip flexor, except instead of going to a stretch, I can even use the wall for stability. I'm going to lift my leg, my back leg off the floor. Now I can bring it to the side, I can bring it back. What I'm not doing is I'm not lifting my head, because we want to maintain the head posture predominantly, and we also want to keep our hips underneath us. We don't want to sway our back forward or sway our hips forward. And I want to connect to this piece of my body. When I can connect to my glute muscle, I know that that is going to help drive my body in a place where I'm not having to worry about my back going out. Because usually people that have low back problems, or also the head positioning, the head posture will throw off the low back. So when these two things are together, the head positioning and the hip positioning, the entire body starts to really relax. The shoulders start to relax, the knees start to place in better positioning, and the feet are even utilized better. So these are very important, very simple ways that you can add into your program of exercise, or just utilize these as a daily routine at the office. Hopefully these are helpful for you. I know they're helpful for me and my clients, and enjoy.